Hello, everyone. Thank you for joining us today. I would invite you to put your name and where you're from and your state and everything like that into the chat if you have a moment. We would love to know who is with us today. And I'm just waiting for everyone's audio to connect, and then we'll start right at the top of the hour. Looks like we're getting some people putting in their info in the chat, which is great. Nice to see Iowa's on and Colorado is on, which is great. Those are two of our states. We have Illinois on too, so now we have 3 of our 4 states. Is anyone on from Oklahoma? Go ahead and keep putting that into chat. I want to get started. Today's Nursing Home Quality Essentials is the monthly NHSN office hours. And I wanted to just kind of go over a few things that I had received in the past month that I wanted to make sure that you guys were aware of. And of course, we have plenty of time usually for any sort of questions you might have, things that have come up, outstanding, lingering questions that you've had. So by all means, you can put those into chat. You can wait till a little bit later. It's up to you. You can always unmute. This isn't a strict webinar, so you're able to communicate with me via audio as well if you'd like to. So by all means, very casual session. So let me know if anything I'm talking about doesn't make sense or you have questions along the way. Feel free to interrupt or throw something into chat because I have an eye on it. Okay, so the first thing I wanted to go over was not long after our last NHSN office hours, they sent out a newsletter. So there's a Q2 in June NHSN newsletter. And so they sent this out on the 14th of June, which was right after our session. And so this one I wanted to take a look at. Actually, this is yes, I wanted to make sure this is the right one. So it just says that the Q2 newsletter is available. This one actually says the patient safety component of NHSN, which isn't you guys, but either way, they put out a newsletter from all the different facility types. And so it's a good thing to check out when you see this newsletter email come through. It's a good thing to check out if you have time because they will sort of summarize any sort of updates they've had and just some other information. I'm going to show you guys the newsletter here in a second. So when you click on the link in that email, it takes you to the newsletter. And the newsletter is kind of broken out. There's any NHSN education and training. Obviously, the patient safety component, that's not one you guys participate in, or the healthcare personnel safety component. That one you might occasionally just because of your staff flu reporting, that one's in there. Dialysis component is not for you guys. There's general NHSN info, which can be helpful. And then sometimes there's a long-term care section as well. So it's just a good idea to maybe check the newsletter. You can look at the contents here to see which ones apply to you. And then there are just a couple things that I wanted to point out to you guys that were in this newsletter. So on page 12, they had this. It's for NHSN admin. So this doesn't mean, it's very confusing, the verbiage in NHSN. So there's an NHSN administrator. That's basically the primary person who does the NHSN reporting. It doesn't mean it's your nursing home administrator necessarily. It's just kind of the point person, the main person. It's an admin for NHSN for your facility. And so they created a training page. When you click on this, and I can put that into chat, it goes over some training videos for adding a new user for your facility, enrolling a facility that's probably not applicable to you guys, generally speaking. Then there's deactivating or activating a user in a facility. So, you know, that's good if some staff member has left, or if maybe they got hired back. That's not an unheard of, is someone, you know, quits for a little bit for whatever reason and then gets rehired. You could actually reactivate them. They don't necessarily have to go through the process again. Reassigning the NHSN admin role, facility administrator role, and then also adding a component to a facility. Right now, you guys should not need to do that as you're mostly reporting in the long-term care facility component. And then once a year, you do that healthcare personnel safety component for the staff flu rates. So when you click on this link, it takes you to, let me see what page it is here. It takes you to this page. So this is the administrator training page. I'll put that into the chat. And so here's little videos, training videos that they did for these various components. So I also wanted to let you know that if you do not want to look at these, Telligent has their own that covers a lot of similar topics. So changing the NHSN administrator role, I have a guidance document here on that. Then how to add a new user. This is a short video. This one also covers how to deactivate people who have left. This one is about that flu vaccination reporting and then adding that component for the first time if by chance it hasn't been done yet. But then I also have some other ones here that are helpful, which is, you know, changing your email address if you ever move buildings, things like that. So, you know, these resources are very similar to ones that we have created also. I haven't gone through these to see how they are. They all look pretty short, which is good. Sometimes their trainings can be a little long and complex, but the fact that they're short is probably good. But if, you know, for any reason, if any of these are too complex or they're talking in some sort of verbiage that doesn't make sense, you can always check out the Telligent ones, because I always go through the CDC resources and then sort of summarize them in something more concise for this page. Okay, the other thing that I really wanted to show you guys is this. So there is an upcoming training, and it is it's kind of an annual long-term care facility training for NHSN. And they're going to cover a bunch of different topics. Not all of them are applicable to you. In a second, I'm going to show you the agenda for the training. So there are some that you may or may not need to stick around for, but there are some that are specifically for the long-term care facility component people. So that's you guys. So when you click on, or when you sign up to take this training, it gives you the agenda. So this is Tuesday, July 23rd. And it's that Tuesday, Wednesday, Thursday. But I'll show you the agenda and walk through it a little bit so you guys can see. This first day is the one that looks more geared towards long-term care. And it says here that it is long-term care facility component. So they're going to talk about respiratory tract infection. There's a pilot project that they've been doing, data for the long-term care facility component, new users, and probably kind of an overview of what reporting is. and then COVID vaccinations, antibiotic stewardship, and then QIN-QIO support with NHSN reporting. So this first day especially is really geared towards long-term care. This training is free, it's virtual. They're based out of the CDC, which is in Atlanta area. And I've been to the training in person, but I think they just decided to shift more virtual. This second day is for the dialysis component, so I don't know that anybody would need to attend this one, as you guys aren't using that component at all. So that day could be skipped. And then this one, there is one here. It says current topics with infection prevention and control in long-term care. So that one's kind of applicable. This is on Thursday. That final day is kind of just a half day. And then they are going to do a little demo here on long-term care facility component HAI reporting. Obviously, you know, reporting on healthcare associated infections right now is not required for you guys, but there is the capabilities of reporting things like C. diff, UTIs, things like that. So I'm assuming they're just going to kind of show people that aspect of NHSN. So this could be worthwhile if you have, you know, some time to listen in here and there. I'm not sure whether it's going to be, if everything's going to be recorded or how they're going to share resources after the fact. I do plan to attend, and you know, if I receive anything very important or worthwhile, I'm happy to share it out with you guys if you think you missed something important. So yes, definitely take a look at this. Here's that link for the agenda if you'd like to see it. Otherwise, there's a big, you know, register now button here that you can use to register for the training. And I might as well click on that and put it in chat if you guys want it. Okay, putting it into chat. Okay, so any questions on what I've covered so far? Either the newsletter or some of those resources. I also wanted to show you guys on that you guys are one of 18,727 long-term care facilities who are enrolled in NHSN. So that's a pretty big number, but you can also see that there's a lot of hospitals in NHSN. There's outpatient hemodialysis facilities and then also ambulatory surgery centers. So these are some of the facilities that all report into NHSN. So you guys are not alone in that reporting. And what can be nice with the fact that, you know, hospitals report into it is you guys could share data and kind of look at things more apples to apples, since NHSN uses the same definitions for stuff. So that has been helpful in the past. In Colorado, once we had worked on looking at C. diff. And so the nursing homes reported into NHSN for C. diff, and then the hospitals did too. And you could kind of extract data that way. Any questions? I'm not seeing anything in chat, but feel free to unmute if you'd like. Any questions about the NHSN reporting?
Yeah, I've been trying to get into the training today. It still says they're working on it. Just wanted to make sure it's not just me.
Oh, which training?
The one that they said will be available a week before the 15th.
Let me go back to that email. 1 week prior to the training, Monday, July 15th, you'll have access to our 7 on-demand videos. So that probably won't be until July 15th because the this training starts on the 23rd. So I'm thinking that it says 1 week prior to the training, Monday, July 15th is when you can access those. So you're just a little early. Any other questions?
Thank you.
Anything about reporting? How is it going? Have you had the staff turnover that's made things challenging? Has anybody had delays in reporting? I know they did an update recently, and I spoke to somebody who said that some of their person level reporting got a little wonky. Let me know what sort of challenges you guys have. It's always helpful when you guys reach out, because then I kind of get a heads up on potential issues that other people might be having as well. Also, I'm going to put into chat my email address. You can reach out to me anytime if you have any NHSN questions. Perhaps you feel a little shy today. You can always just email me. The great thing is I can hop on a Zoom call with you and we can share screens and take a look at things together. I'm happy to do that. So this isn't your only opportunity, but we like to use this session kind of as an information sharing time. And then also if you do have any sort of nagging questions that maybe other people can learn from too. Because I think a lot of times that one person has a question and it's a question that a lot of other people have as well. So it's always good to ask those and be able to share the answer. Anything else for NHSN? Okay. I'm happy to stay on. This session is a half an hour. And everything I covered today, it just must not have, been super complex for you guys. So I'm happy to stay on. And if you guys do have questions that come to mind, maybe you're trying to log in and you thought of something, I'm happy to stay on until the 30 after. But if you have other things to do, by all means, I'm not going to keep you. So you are happy, you're fine if you jump off the call. But by all means, second Tuesday of every month is the NHSN office hour. So if you want to make a note of that and maybe have your NHSN reporting person join. I know sometimes that's your MDS person, it's your business office person. I mean, it's not necessarily who typically might attend these calls. So by all means, if you want to note that and have them join in the future on the second Tuesdays, that'd be great. Otherwise, I will be on, and if you have a question, you want to unmute or throw something into chat, that'd be great. I can always log into NHSN if you want to look at something. So just let me know. I will be here.
Hi, are you still available? I do have a question.
Sure, I'm here.
Our facility recently, how you put in the number of total staff. Recently our dietary department is now contract from another company that came in and took over our dietary department. Do I just change those numbers to contract and away from full-time staff?
Let's see here. So I always go to the data collection forms and instructions, and they have one for the healthcare personnel table of instructions here. So let me open that really quick and let's see if it doesn't tell us a little bit more. So this is your healthcare personnel, your denominator. And so they have staff on facility payroll, they have your licensed independent practitioners, et cetera, adults, students, trainees, and volunteers, and then other contract personnel. So I would assume that then they would fall into that other contract personnel. You can just kind of move them into that category. Yeah.
And then our facility is very unique. We have shared departments that our employees are also shared with the hospital side. And pretty much from the start, we've been just reporting everyone's vaccinations because they have the potential to maybe work on the long-term care side, but they're usually full-time on the acute side. But we were looking at trying to define that to where I'm not counting the shared departments, just 100% of the people who are working on the long-term care side, but it's going to change our numbers probably significantly. Would that be a red flag to NHSN? Like, why have all of a sudden they're reporting 50 employees less? Or is there a way I can explain that? Or
Well, let me take a look. I might not be able to find it while we're talking here, just because it's hard for me to talk and read at the same time.
oh, sure.
But I think in one of these questions, it talks about that when if you have shared personnel, whether you count them or not. And I believe you do, but I want to make sure that I find it in here.
Okay.
So you might want to just keep them in, actually. That might be what they recommend, but I'll look for it. And I'll jot your name down so that I
Sure.
But I'm pretty sure that they have something in there about that, because so many times, some of your staff works in the long-term care side, or maybe you have an AL side and they work in both. So let me dig and find that guidance, and then I'll send that to you.
Sounds good.
Was that all your questions for today?
That was
Now?
it.
Okay.
Yes.
Thank you.
All right. Thank you.
All right, I see, Lydia, your question, I'm new to the position, how do I access the website? So, if you, are able to unmute, I'd love to ask you a couple follow-up questions.
Yes, ma'am.
Hi, Lydia. Are you kind of a new IP at your building, or?
Yes.
Okay, and did your leadership tell you they wanted you to do the NHSN reporting?
Yes. So the person that had the position left before I could train, but they told me that I did have to report like certain things on this website. And then I've been coming to the meetings and getting like information, but I'm just trying to make sure like how do I access and put in the data?
Okay, and then does anybody else have access right now? Like, is someone doing the weekly reporting for
Yeah,
your
the
facility right now?
DON, the DON.
Okay, so I will need to connect with you. Again, I'm gonna write your name down. I'm gonna need to connect with you and your DON, because your DON will need to add you as a user, and then that'll kind of jumpstart your process to get access. You've
Okay.
never had access before at like any other building or
No,
anything like
ma'am.
that? Okay,
ma'am.
yeah. So I'll connect with you, and then we'll find a time when you and your DON can kind of jump on a quick Zoom call, and then we'll kind of start your process.
Okay.
Sound good?
Yes, ma'am.
Awesome.
Did you need my email?
We should have it. So,
Okay.
yeah, I'll reach out to you after.
Okay.
Thank you.
Thank you so much.
Anybody else? We still have 8 minutes, and I'm happy to hang out for those 8 minutes and field any questions that come to mind. Happy to log into NHSN if need be. That turnover sort of question, needing access, that's a big one. So, and it's not easy. And then, if the reporting or lack of reporting comes with some big penalties, so it's always good to have backup users, have a backup plan, things like that, just so you don't get caught out weeks upon weeks with no reporting. this page that I ended up on, when you go to the COVID-19 reporting page, this is for long-term care facilities. There is a frequently asked questions document. So if the table of instructions doesn't answer your question, for whatever reason, they've created a FAQ document that also kind of has some additional questions that sometimes come up. Okay, I see a question in chat from Margarita. Do we have to have SAM's level 3 access to access NHSN? I would say generally speaking, you do. Level 1 access was created in the height of the pandemic, or at the front of the pandemic, in order for nursing homes to get up and in as soon as possible. The default new access for the past couple years has been level 3 access. If by chance you still have level 1 access, you can upgrade it to level 3. But I feel like level 1 access at this point is fairly rare. There's also a couple different things, features of the NHSN reporting that you might not be able to do unless you have level 3 access, just because that's like the higher security version. So, you know, if you don't have level 3, then you probably would want it. If you don't know what level 3 is, because, you know, again, that's NHSN jargon. It's when you use this login, SAM's multi-factor login. So it means that you sign in not only with a username and password, but then you either have a plastic grid card, which kind of is the old school version of what they did, but you'd either have this plastic little credit card with all these numbers and letters on it, and you'd put in a code once it prompts you after you use your username and password. Or the more common version now is they do an app on your phone. And then when you open the app and you're logging in, it gives you a code that you can put in. It like auto generates a code. So that's how you know if you have level 3, is you probably log in with one of these. If you're just using username and password and no additional code, then you're level 1. Does that help, Margarita? Awesome, thank you. Any other questions, things that have kind of been on your mind? Because it's not very clear sometimes, and it's nice to be able to get a little clarity once in a while. We have 4 more minutes. Also wanted to point out that our event page has all of our upcoming events, including additional topics for the Nursing Home Quality Essentials. These are on Tuesdays and Thursdays. And so here you can see this is us today, the NHSN office hours. But then we do try to put in the subject of some of the upcoming sessions as well. So you can see whether any of these sessions are ones that you want to join, think would be helpful, things like that. And these are all pretty casual. They're 30 minutes each. And if you can attend, you can attend. You can register for all of them, and then that way they're on their calendar. And then if you're free, you can join them. We have a couple other events that pop up now and then. We also have the recordings of these events. Those are also posted. And then also wanted to make sure that I showed you guys that we have an infection prevention page, a bunch of different resources on that. And then also we have a Vax Hub. So this is all things vaccination. Let's see, it's taking a second here. So there are a bunch of different resources here. This adult vaccine toolkit is relatively new. And it has a wealth of knowledge on all things vaccinations. So this one's a really good one if you want to check that one out. But otherwise, a lot of just different vaccination resources are here. It's a good time to start planning. I know respiratory virus season is technically over, but it's always good to start planning for fall and taking a look at your program and kind of how you can make sure that you have all your ducks in a row for when that comes around. Okay, one more minute left. Again, if you want to send me an email, if you prefer to just kind of talk behind the scenes, that's totally fine. Shoot me an email and we can talk through things, set things up. Happy to do that. Otherwise, I will be back on this call the second Tuesday of next month. Hope you guys have a wonderful day.